Does your face look tired or sad even when you feel fine? If so, drooping corners of the mouth might be to blame. It's a small detail that can change your entire face. It makes you look older, distorts proportions, and ruins your facial expressions. And this can happen even at a young age. In this video, I'll show you why the corners of the mouth droop and what you can do about it. Which methods really work? My name is Monika, and I am an aesthetic medicine doctor from Krakow. And now I'll tell you why drooping corners of the mouth are a more important problem than most people think. And to explain this, I have a story from my medical studies for you. During a psychology class, the lecturer told us to put a pencil in our mouths. Like this. We did this to experience firsthand how a smile can change your mood. Even one as artificial and forced as the one you get from putting a pencil in your mouth. If you don't believe it, try this test at home. Hold a pencil in your mouth for 2 minutes and feel how your mood changes. But you know what? In this experiment, the pencil itself matters the least. It's actually not needed here at all. What matters are the signals we send to our brain. Many studies show that if you start smiling when you're in a bad mood, your mood will improve. And now pay attention. Knowing everything I've explained so far, how do you think a person who constantly has drooping corners of the mouth and an increasingly sad facial expression might feel? Exactly. Drooping mouth corners are a more common problem than you might think. Every few days, I have a patient who tells me that the main reason she decided to visit my aesthetic medicine clinic was that people started asking her, "What happened? Why are you so sad? Are you tired? Didn't you get enough sleep?" And this was despite the fact that everything was great for her and she actually felt really good. In my opinion, the way we look and how we are perceived by society has a significant impact on our well-being. And since everyone cares about having the best possible quality of life, I believe that drooping corners of the mouth are a very important issue. That's why now we're getting down to specifics. Now I'll explain to you in an understandable way what causes drooping corners of the mouth, as well as the best ways to address this problem. There are 4 reasons why you might have drooping corners of the mouth. The first reason is special because it doesn't depend on age. It's about the very shape of the lips. So the corners droop because the lips are shaped that way. This especially refers to the corners drooping while speaking or making facial expressions. Around the mouth, we have a special muscle, the orbicularis oris muscle, which can work a bit differently in each person. And so, while speaking or making facial expressions, you might notice your lips curling inward or the sides of your mouth tucking in, which will form a kind of lock shape. However, the orbicularis oris muscle isn't the only one that can cause issues here. A much more common reason for drooping mouth corners is the second cause, which I'll talk about now. And I'm talking about the DAO muscle, or DAO. If you haven't heard about the DAO yet, that's great, because I'll explain everything to you. Another Polish name for this muscle is the depressor anguli oris muscle. It does exactly what its name suggests. And the best example to show this is Barack Obama. So every time we want to make that approving expression, or as I call it, the Barack Obama face, this muscle gets activated. But that's not all. In addition to this muscle, we also have another muscle, the platysma, which is responsible for tightening the neck in such a way that lines appear on the neck, as you can see in the photo. Unfortunately, both of these muscles are also responsible for pulling the corners of the mouth downward. You can do a simple test now and check this on yourself by tensing your neck muscles in this way. And now, pay attention. Some of us may have these muscles very strongly developed and very active, overactive in fact, which means they can create very pronounced folds on the neck or pull the corners of the mouth sharply downward. And if we do this often every day and for years, the corners of the mouth change significantly precisely because of this. It's worth checking for yourself how strongly you can make that Barack Obama face, and also asking those close to you how often you make that expression. Because if that's the case for you, even if you don't realize it, sooner or later the corners of your mouth will start to droop as well. Okay, we've already discussed 2 causes, receding lips and the action of the depressor anguli oris muscle and the neck muscle. There are still 2 more causes that aren't talked about much, but they're important for you to have a complete picture of the situation. The third cause is the cheeks. Yes, the cheeks can also affect the shape of the lips and cause them to droop. Do you want to see how? If you press your cheeks and slide your finger downward, you'll notice deeper nasolabial folds, and this added weight will also cause the corners of your mouth to droop. And that's the third cause. So, as we age, the skin becomes more saggy and loose because there is no subcutaneous tissue to support the cheeks. And then this extra weight acts just like my fingers did in our experiment. But be careful. We lose subcutaneous tissue with age not only from the cheeks, but we can also lose it from the area below the lips. So right here, if we start to lack support here and there are deficits under the corners, the skin won't have that support and will be pulled downward. Now that we've discussed all the causes of drooping mouth corners, I have 2 pieces of news for you. One good and one bad. I'll start with the bad one. The thing is, the corners of the mouth can droop not just for one reason, but for several at once. That's why the doctor should know exactly why the corners are drooping before performing a procedure. And sometimes it's very complicated and requires considerable skill and experience. But there's also good news. Later in the video, I'll explain in an easy-to-understand way what to do to deal with drooping mouth corners in any situation. Before I move on to the solutions I recommend for drooping mouth corners, I have some important information. I've written a great ebook called Understanding Cosmetics, which will help you understand cosmetics and make good decisions about your at-home skincare. In the book, I recommend as many as 140 products with excellent ingredients. Check out the link in the description below the video and see why it's worth having the knowledge I share there. Just like we had 4 causes, I also have 4 best solutions for each of them. If the cause is receding corners of the mouth and the overall shape of the lips, the best solution is lip contouring with hyaluronic acid. And here's an important note. This procedure doesn't always mean visibly enlarging the lips. In this case, the word contouring is better because the right needle technique will give the lip shape, not necessarily adding volume. The result? Lips that look good in every situation and with every expression, without drooping. The second cause was the brow muscles and neck muscles, which pulled the corners of the mouth downward. In such a situation, we talk about a disturbed balance between the muscles pulling downward and those that should be pulling upward. That's why the solution in this case is to weaken the action of the depressor muscles in order to restore balance and harmony. We do this with the help of botulinum toxin, that is Botox. We precisely inject the preparation into the depressor anguli oris muscles and the platysma muscles. As a result, after such a procedure, even if you try to make that facial expression, it's not possible to the same extent. And thanks to this, the problem doesn't worsen. However, a word of caution. If you already have visible marionette lines, meaning those lines running down from the corners of your mouth, or if the depressions under the corners of your mouth have already formed, then botulinum toxin will not help with that. I want to emphasize that in such a situation, the toxin will prevent the problem from getting worse, but it will not reverse the changes that have already occurred. So what can reverse the changes that have already taken place? If you have visible marionette lines and tissue loss below the mouth, it is possible to fill these areas with hyaluronic acid. In other words, with the help of a filler, we try to restore the lost volume of the subcutaneous tissue and bring it back to what it was, for example, 5 or 10 years ago. Thanks to this, a sort of scaffold is created for the corners of the mouth, allowing them to once again rest on the filler, just as they used to on the natural subcutaneous tissue, which is no longer there. And what if the drooping of the corners of the mouth is caused by the cheeks? In such a situation, we also use fillers, hyaluronic acid or fat grafting, that is lipotransfer. Here I'm talking about volumetric procedures and administering filler, for example, in the temple area, the zygomatic bone region, and the lateral part of the cheek. As you've noticed, we perform these facial volumetry procedures to create a framework for all the tissues below, so that the cheeks don't sag. By performing such filler procedures consciously and with technical skill, you can expect beautiful, natural results. If you are in the hands of a professional, the goal is to use as little product as possible to achieve the greatest possible effect. In addition to fillers, it's also worth considering the use of strong tissue stimulators to thicken and firm the skin, specifically in the upper lateral areas of the face, that is, on the temples and cheekbones. However, for the difference in denser skin in the upper third of the face to actually translate to the corners of the mouth, it is usually necessary to use helpful tissue stimulators, such as polylactic acid or calcium hydroxyapatite. However, tissue stimulators won't make sense for every case of drooping mouth corners. It's also worth knowing that the effects of stimulators will be delayed over time, meaning they won't appear immediately like with hyaluronic acid. I'm saying this because I know that many patients are afraid of fillers and artificial effects, but I assure you, the procedure is only as good as the person performing it. And since you don't trust anyone as much as you trust yourself, I'll answer the question. Can you do anything on your own for drooping corners of the mouth? Are there actually any things we can do at home for drooping corners of the mouth? The answer is yes, but we need to have reasonable expectations. At home, it's worth doing facial massage, which helps to relax muscle tension and can be beneficial when drooping mouth corners are caused by excessive muscle activity. However, facial massage will not help with the loss of subcutaneous fat tissue, which is one of the other causes discussed in this video. It's also important to perform massages regularly, because only then is there a real chance for noticeable results. Exactly. So, what about the results, and what can you actually expect? If you were to remember just one thing from this video, I'd like it to be this. There are effective ways to address drooping mouth corners. Just as I mentioned at the beginning of this video, the way we see ourselves in the mirror can have a real impact on our mood, happiness, and simply the quality of our lives. So if you see someone different in the mirror than who you really are, and drooping mouth corners or a slightly sadder appearance annoy you, know that there's probably something you can do about it. In the hands of a good aesthetic medicine specialist, you can achieve beautiful results. Speaking of beautiful results and choosing the right specialist, I recorded a video in which I talk about how some clinics try to upsell procedures and what tricks they use to get patients to pay as much as possible. So if you want to learn how to make smart decisions at an aesthetic medicine clinic, be sure to click on the video thumbnail that's now appearing on your screen. I'm sure this video will save you a lot of disappointment at the clinic. I also have a small favor to ask. If you found this video interesting, please leave me a comment below for better reach. This way, YouTube will show it to more people. Thank you for that and for watching my videos. See you in the next one. Kisses.